this is kind of like a fascinating, just kind of tying the whole anatomical picture of people and actually
hmm
looking at people holistically. I know
hmm
we always break down our podcast where we go region by region, but that's just to dive deep in one area at a
hmm
time.
Yep.
But the reality is, we're all walking around as holistic people, functioning as
hmm
an entire, you know, everything synergistically working together.
hmm
So usually I love listening to your presentations on anatomical and fascial trains.
hmm
So what is kind of the tie-in for the lumbar region when it comes to this, Ben?
Right. So for the lumbar region, there are, there's superficial layers, of course, and then layers that are deeper below those superficial layers. So you have, like you have the erectors that travel, all the way up and down the spine and attach, you know, all
Hmm.
along the spine. So you can, you know, imagine, think of it as one, as like as a network of highways, and then you have, it's imagine like you're trying to, get from all the way from, the pelvis all the way up to the neck or whatever, but then there's some construction going on,
Hmm.
right? Um so yeah, so every, we talk a lot about how everything is connected there together. Particularly um, one of the areas with low back pain um, that I definitely take a look at if somebody comes in with that complaint is going to be the quadratus lumborum
Hmm.
muscle, because it's one of those deeper muscles that attaches not only to kind of like the towards the end of um, the spinous processes, but then all it attaches to the last rib as
Yep.
well as the top of the iliac crest. So it's kind of like that. Um, it's that deeper um, structure that kind of glues everything together there
Yeah.
as well. So
Well, and
um,
then by the sounds
hmm
of it, you're talking about a muscle that again crosses multiple regions. So you're
hmm
talking about something that's going
exactly.
to have some
hmm
influence on where your pelvis sits in
hmm
space.
Right.
And because it has attachment to that last rib, it's going
hmm
to change some of the positional of the thoracic region. So it's
hmm
not just lumbar alone
hmm
there, right?
Right. Right.
Yeah.
So like you can imagine like if you're trying if there's tightness or any type of restriction in there, and you're trying to you know do any type of like terminating, and that's all restricted. You can imagine the difference getting that worked out um, can make. So
Yeah, most definitely
hmm
can. So,
hmm
and then my little input as
hmm
far as holistic picture is I like emphasizing again, we've talked about in another podcast, lower cross syndrome. So,
hmm
again, there's going to be like this cross pattern of muscles that are overactive and over recruited and therefore likely to generate pain. And then usually the opposite side of the body, you're going to have that
hmm
weak, underutilized, and needs to be brought up in strength. So when
hmm
we're talking in the low back here, again, those lumbar erectors and that QL muscle usually
hmm
have to frequently pick up extra workload because a lot of people aren't strong enough in the abdominals.
hmm
And then it crisscrosses across the pelvis, and you usually will see the glutes be weak
hmm
and the hip flexors be over tight through the front.
hmm
So again, just as far as like, hey, all this stuff is going to tie down into other regions and whatnot. No question, if you're having problems in the lumbar erectors, you can almost put dollars to donuts that you're going to
hmm
see some insufficient function at the hips,
hmm
and certainly moving your way up the anatomical chain and start to
hmm
possibly see involvements in like the shoulder blade region as well too. So